Good afternoon. My name is Lucy Aquino, Chief Executive Officer of Hispanocare, a program of Advocate Illinois Masonic Medical Center and affiliated with Gottlieb Memorial Hospital. Today, we're talking to you from CAN TV Cable 21, a live interactive show. If you have any questions regarding today's topic, please call us at area code 312-738-1060. The number's at the bottom of your screen as well. Today I have with me Dr. Mukesh Jain from Advocate Illinois Masonic Hospital, and Dr. Jain specializes in cardiology. Thank you for being on the show today.
Thank you for asking me to be here.
Today's topic is so interesting and so much that we can learn regarding heart disease, and that's what we're talking about today, right, Dr.
Yes.
Jain? So we'll be talking about heart disease and hypertension. Again, thank you for being on the show. This is one of those topics where I believe that not enough is being talked about, especially as it relates to heart disease, hypertension, and the effects of heart disease, the risk of heart disease, and the number of people that die every day from this particular disease. Dr. Jain, we know that cardiovascular disease in general is a name for a wide variety of disorders and a disease condition that affects the heart and sometimes the blood vessel, as well as the leading cause of death in the United States. And it's my understanding that 1 in every 3 deaths is from heart disease and stroke, which equals to about 2,200 deaths per day. That's astonishing.
It is.
That's astonishing. So, Dr. Jain, can you tell us what is all kinds of things that people hear about?
Sure.
But what is a heart attack?
Heart attack happens when the oxygen-rich blood supply to a section of the heart gets interrupted suddenly. If it's not reversed right away, you get heart muscle in that section starts dying. Now, as Lucy said before, that heart attack is the biggest number 1 killer in the United States of America. Every 34 seconds, some person is getting a heart attack. And if the good news is that we have made a lot of progress in the management of heart attacks. The patient comes in time. Time is of the essence. As soon as you get chest pain, you don't like it, call the ambulance, 911. Don't you ask your relative to drive you to the hospital. But in case you need some help on the way to the hospital, then paramedics can supply the emergency treatment at the same time. So it's necessary to know that as soon as you get some symptom which you don't like, which are coming from the chest, call 911.
And that's a lot of times it's what happens. You know, people will have particular chest pains, and we're going to get into the risk of heart attacks. But I know that sometimes, you know, especially what we see in community, as we're out there and we're doing blood pressures and we're doing cholesterol checks, and folks would tell us, oh, you know, I feel these pains in my chest, but they come and they go, but sometimes I feel worse than other times. But they're not doing anything about it.
Yes.
And they're not following up.
So just picking up where I finished, heart attack usually happen due to a process of a waxy substance getting deposited inside the arteries called plaques. And most of the time, these plaques grow over years and are silent, have no symptoms. But once in a while, the plaque can rupture, clot forms on it, and if the clot is large enough, they'll get a heart attack where the heart muscle starts dying. But if the patient comes in time to the hospital, we have facilities and the treatment modalities where we can open the artery right away and limit the damage of the heart attack. So a lot more can be done. That will certainly reduce the mortality, loss of life, or disability in the future, like with heart failure. Or sometimes people get irregular heartbeats where their blood pressure can drop or they can have a cardiac arrest. If they call for help in the fashion which is right away, we can really help the patients.
So, Dr. Jain, why do some people have no symptoms at all?
Sometimes elderly people or women or people who have diabetes do not get symptom of chest pain. Or sometimes they get funny in the upper abdomen and they think it's from the stomach and they ignore it. I always say heartburn, if it's from the heart, it can come and kill you. If heartburn is from the stomach, You can take whatever other antacids or Zantac or whatever medicines you want to take, won't kill you.
But if you're taking a Zantac and you're taking a Tums or Rolaids and you still have that pain,
you should call your doctor right away and make sure it's not coming from the heart.
Right. Dr. Jain, we have a caller.
Sure.
Caller, you're on the air.
Hello, my name is Ruth, and I have a history of heart disease. I'd love for you to expound on that. My daddy died of a heart attack, and my grandmother had heart disease, and my sister struggled with heart disease as well. Could you expound on heart disease, if you can? And I'm afraid I'm having the same problem.
Okay, we'll be very happy to do that.
It's my pleasure. There are two kinds of risk factors we have. Something we cannot change, like genes. We cannot change our parents, right? We can change our age. So increasing age and the family history is important. But the other things we can do, like body weight, sugar control, not smoking, controlling the blood pressure, keeping the cholesterol low, and exercise on a regular basis. People say, gee, doc, I don't have time to exercise. Of course you do if you want to.
Right.
So if we can control the risk factors, we can reduce the chance of a heart disease. Heart disease simply means there's some artery here is blocked with a cholesterol deposit with a bad cholesterol called lousy cholesterol or LDL. If we can take medicines nowadays, which are very well tolerated without any significant side effects, we can slow the progress of the deposit of this bad cholesterol in the coronary arteries and other parts of the body. So certainly we can help you if we can control all these factors. As I said, keep the body weight down, keep the pressure under control, keep the bad cholesterol LDL less than 100, don't smoke, exercise every day, and see your doctor on a regular basis.
So Dr. Jain, I mean, the caller mentioned that it runs in her family. I mean, it's so prominent, sister, family. I mean, it's just all there. And she's now going through some of the same issues. But even if it runs in the family, and if you take all these preventative measures, you can actually prevent it.
It will definitely help you, no doubt about it.
So what we're saying is that because it runs in the family, does it mean that it can happen to you?
You're so right. You can control the other factors, and we can really, really reduce the chances for a person like you getting a heart attack.
So diet and exercise, I mean, as much as sometimes we hear this all the time, you have to diet, you have to exercise, you have to watch what you eat. You have to make sure that these are the things that you can do, that are simple things to do. There are so many different ways of controlling weight, counting calories, doing these things, but most importantly, doing it under a physician's care.
I think the other important thing is this cholesterol business. Cholesterol should be less than 200 milligram percent. Bad one called LDL, I call it lousy cholesterol, should be less than 100. And the good guys, SDL, should be high, close to 60.
Okay.
Nowadays, we do have medicines which can really tilt the balance in your favor. See, SDL is like a garbage pickup truck. Pick up the bad cholesterol LDL and dumps in the liver. So we not only need to know what the total cholesterol is, we need to know the different fractions of it, like SDL and LDL.
Right. And those are the important things to remember. What is the LDL, the LDH? What are those levels? Where should they be? Dr. Jain, we have a caller. Caller, you're on the air.
Hi. I wanted to know, what exactly does exercise do for your heart? Is it the idea that it's a muscle and so you're working it out? I don't get that. And then can you talk about how some people I've heard stories of people, athletes, who kind of drop and die during some type of athletic event or whatever because they had heart problems. If you can talk about that a little bit.
Sure. I think
Thank you, caller.
by exercising on a regular basis will slow down our heart rate. Instead of heart rate beating at 90 beats per minute, it may come close to 60 beats per minute. So you're reducing the demand of the heart for the oxygen for the body by 33%. That helps a lot. When you exercise, then the calf muscles get stronger, and they are mini pump in the body to return the blood to the heart. So heart has to work less hard.
So sort of like
has to beat less often, and blood pressure under control. So resistance in the body against which heart is pumping is lower. So heart requires less oxygen for itself to function. So that's where you get different benefits. Other people say exercise might release some endorphins in the brain and make you feel better. Of course, all of our are psychologically based people. We all like psychology, so that helps in different fashions.
Right.
I hope I answered your question.
So, in other words, let's even make it even simpler then. The heart is working, and you get into a regular exercise regimen. So, when you first start working out, you might feel that much more tired. You might feel even, who knows, maybe even palpitations and heart pain and chest pains and some of these things. But as long as you're healthy under a doctor's care and you're exercising the way you should, and then as time goes on, like anything else, it gets easier. Then it becomes a no-brainer.
Sure. To answer the second part of the questions, athletes. If athletes have some underlying disease and that get precipitated by strenuous physical exercise, like 26-mile marathon running, you don't know. So most of the athletes, before they take part in Chicago Marathon, as example, go to a doctor who should order a stress test with the echo called echo stress test and see how the effect is. If the stress echo is normal, then 1% chance of still something happening bad in 1 year. But at least that screens 99% of the people, and then you're safe.
And that does happen a lot. I mean, we do hear that you do have runners who are preparing, who are working out, who are doing the things they're doing, but the one thing they're failing to do is going exactly as you're saying for that stress test.
Yes,
that's
they
one
have
of the
to.
Things that, and they're not doing it.
I hope I answered your question.
We hope so too. Thank you, caller. Great question. We have another caller on the air. Caller, you're on the air.
Yeah. Hello. Along with the heart problem, I have hot flashes. How does that interact with the heart problem? I have hot flashes,
Okay, you have hot flashes, and do you have also heart disease?
Yes. I'm calling because I have a family history of heart disease. My father and my mother, and we also suffer from hot flashes. My mother had it. How does that interact with my heart? I mean, is there something I can do about that to prevent my hot flashes?
Sure.
Dr. Jain will answer that for you. Thank you, caller.
Okay.
Heart flashes usually in women indicate they're going through the change. If you're going through menopause, after the menopause, the risk of heart disease in women is same as men. Before menopause, your female hormone estrogen protects the woman against heart attack. Relatively speaking, not zero, but relatively speaking. But after you go through the change, then your risk of heart disease or heart attack is same as men, and then you need to see the same thing. Keep the body weight down, keep the blood pressure under control, don't smoke, be active every day, and go to your doctor and let them check your cholesterol panel, bad cholesterol, good cholesterol. If necessary, do an exercise test, and that will sort of screen. I always say going to church doesn't mean you can't fall sick. So, but you do your part.
Right.
You go through
and
the
again,
process.
we have a pattern going here because we keep coming back to exercise, diet, stop smoking, sleep well, live well.
Yes.
And
absolutely.
If you're working or planning on running a marathon, make sure you do it under a doctor's advice and get that stress test.
Absolutely.
So, Dr. Jain, let me ask you this. A lot of times, we talk about, or we are talking about heart disease, and we're talking about some of the complications that come along with that. But if you have heart disease and heart attacks can happen, and maybe more than once or twice, does that leave you permanently damaged with the heart? Is that a permanent damage, and can it heal?
Again, we come back to time is money. If you're getting a heart attack, call 911, go to the hospital right away. Nowadays, we have clot-busting medications we can give if there's no bleeding tendencies in the past, or we can take the people to the special room, called a X-ray room or angiogram room, take the picture of these 3 arteries of the heart, right front artery here and side called circumflex, and find out which artery is blocked. Then nowadays we can put a balloon, crack it open, and we can put a stent.
Oh, we actually have that. We'd like to share
I just
that with
brought
you.
a model of the stent.
And this is it right here. And it's like a little
Coil made out
little
of
coil.
platinum and
Right.
cobalt, and you can
very
put
small.
there where the artery was blocked, so artery won't collapse back. So there are a lot more things you can do where you can really limit the damage, which will prevent loss of life and further complication like heart failure.
So, but your heart can repair itself?
No, again,
No.
time is money. In case you can open the artery within design parameters across the country, then you really limit the damage, and long-term effects are
So as
minimal.
you're saying, if you feel that you're having a heart attack, you have the signs or the symptoms of a heart attack, call 911.
We can talk about symptoms of heart attack. Only 1 out of 3 get classical Hollywood kind of symptoms, squeezing pain, and they collapse on the floor and they take a picture. 2/3 may have pain in the upper body, in the arms, pain in the jaw,
Right,
pain in the neck,
right.
pain in the area between the shoulder blades, shoulder, tingling in the pinky finger, little discomfort in the upper abdomen, which people might upset stomach. You may break in cold sweat. You may get short of breath, or you may feeling that I have no energy and I can't walk. So there are
Right.
different manifestations, and sometimes people go to a dentist because they got the jaw pain, but his jaw pain may be referred because they're coming from the heart.
Right.
Or sometimes they go to a bone specialist thinking shoulder ache, maybe frozen shoulder or shoulder problem. So one has to be really careful. If you get these symptoms with physical exertion, that really indicates coming from the heart.
And of course, we're saying that not all chest pain is a heart attack.
Absolutely correct statement. Not all chest pain heart attack. In this model, we have blockage in one of the arteries, which is 70%, in this artery here, and plaque is intact. It's not cracked. So these people will not get any symptoms called angina while they're resting because heart is not working too hard.
Oh.
But they decide to go for a walk, 4 blocks, 8 blocks, body is working harder, heart has to work harder. Heart says, where is my oxygen? Give me more oxygen, give me more oxygen.
Right.
And extra oxygen cannot be provided through the blockage. So the people will get chest pain, which will disappear when they sit down and rest. So that's called angina. That does not result in any heart damage.
Okay. Now, I know that a lot of times people will say they've had a heart attack or they'll call it something else. I know there are different medical terms for a heart attack.
Sure.
What are those terms?
Heart attack is the simplest layman term. Scientific term can be myocardial infarct. Myocardium is heart muscle. Or it can be coronary thrombosis. Or it can be called coronary artery disease or acute coronary syndrome. Depending on the degree of blockage with the clot, it can be either big heart attack or minor heart attack. So they are the same spectrum of the same disease process.
But nonetheless, a heart attack is a heart attack, whether it's mild or whether it's not.
The key here is that 50% people die within 1 hour of a heart attack if they don't seek medical attention. So again, call 911 right away. And people die on the street. Our mayor of Washington, of Chicago, a long time ago,
yes.
died in office.
Right.
Obviously, he must have some underlying heart disease. So sudden cardiac death, 50 to 70% people is due to cardiovascular disease. And when these people go through the autopsy, 30% have evidence of acute heart attack, which was responsible for the sudden death.
No, wow. I do want to remind our viewers that our lines are open. If you have any questions for Dr. Jain, cardiologist, specializes in cardiology, that's our topic today. Cardiovascular disease and heart disease. The numbers at the bottom of your screen. Now, I also want to remind our viewers that today we have with us Dr. Mukesh Jain, cardiologist, and he's located at 111 North Wabash in Chicago. Now, doctor, what is your phone number? Should our viewers have questions for you? Where can they call you should they have questions?
312-726-9518.
Can you give us that number again?
312-726-9518.
Thank you for that.
Thank you.
Now, Dr. Jain, is a heart attack the same as a cardiac arrest?
No. Cardiac arrest, majority of the time, is due to heart disease. a heart attack, but there are some other conditions which can cause cardiac arrest. Could be dilated heart with a weak pumping function, cervical heart disease with the electrical system has some abnormalities which can cause sudden death. But majority of the people will have underlying coronary artery disease, and out of that, majority will be having a heart attack on the street. So again, it's very important. Right away, call 911. Sooner you get to the hospital, sooner we can open the artery with a balloon and the stent and limit the damage because of heart attack.
Dr. Jain, what are the risk factors for developing cardiovascular disease?
High cholesterol, overweight, blood sugar not under control, lack of activity, and smoking.
Okay.
So all these factors we can control. Don't smoke, keep your weight under control, keep the blood pressure under control. You'll be surprised to know across the country only 50% people blood pressure under control.
That is unbelievable.
In spite of our best efforts. Good news is over last 30 years it has gone from 23% to 50%.
Wow.
But still long way to go.
Sure, sure.
So keep your cholesterol down, exercise on a regular basis, and watch for the symptoms.
Now, Dr. Jain, it used to be that heart disease, or in this case, if you had heart issues or conditions thereof, or the vice versa of diabetes, used to be they were always treated separately, but now it's kind of looked at as a cold disease, because if you're diabetic, chances are you may have heart disease.
Sure. All these are, I call, chips of the same block. High blood pressure, high cholesterol, high blood sugar, overweight, lack of activity, and smoking. They really insult each other and compound disease, which is the heart attack, or people can get stroke, or people can get kidney failure, or people can get blockages in the legs, where people get muscle cramp while they're walking and they're okay otherwise.
Right.
We're not talking cramps at night. They are different.
Right.
But if you get cramps in your legs and legs get tired with walking, most likely that is due to blockages of the arteries going to the legs because of cholesterol deposit. So one has to look into end organ damage of all these things. High cholesterol, high blood pressure causes stroke. High blood pressure causes kidney damage. High blood sugar causes kidney damage, eye damage, brain damage, heart damage. So we really have to control all these risk factors to come ahead and beat the disease.
Very important. Again, we want to remind our viewers that if you feel that you have any of the symptoms that we have been talking about today, or that you feel that you've had some chest pain or discomfort thereof, see your doctor. Don't put it off. It is so important to your life.
Absolutely.
And to those who love you and the ones that you love. It's very, very important. So learn the signs of how to prevent. Now, doctor, I know that as with men, women most common heart attack symptoms are chest pains and or discomforts, but women are somewhat likely different. Now, you talked a little bit about that earlier. We talked about the jaw pain.
Sure.
Now, the shortness of breath.
Yes.
Now, is nausea, vomiting, and
I
back
think
pain also correct?
a lot of women sometimes just feel a little funny in the stomach, get a little nausea, and they think because they had some suit the stomach and that's why they're getting sick. But if there's a pattern to it, that you get once a week or twice a week, that you get symptoms like that, ask for help to make sure it's not from the heart.
Absolutely.
Because the bottom surface of the heart, which sits on the diaphragm, when that's involved, that irritates the diaphragm and people can get belching. People think I had discomfort in my belly, I belch, I'm better.
Right.
But that can be a sign of a heart attack on the bottom surface of the heart. So one has to really be careful. If it's coming from the stomach, won't kill you. If the chance is coming from the heart, can have bad repercussions.
Absolutely. Dr. Jain, our time here goes by so quickly, and I know that we have to move on. We have another show that's up and coming.
Sure.
It's very important information for our viewers, but I do want to remind all our viewers that please learn the signs and the symptoms of a heart attack. On behalf of all my colleagues at Hispanocare, Illinois Masonic Hospital, Gottlieb Memorial Hospital, and Dr. Jain, thank you so much for joining us today and having this discussion of importance to our community, for our viewers, and for all those who are listening. We have to have you back.
My pleasure. Thanks for
Thank
the
you so
opportunity
much.
to invite me, and I feel flattered I was of some help to describe the heart disease or heart attacks.
Thank you very much. Thank you for watching CAN TV. Thank you, Illinois Masonic. Thank you, Gottlieb. And until next time, we'll see you soon. Stay tuned for more information. Thank you for watching CAN TV 21.
Thank you.